What if something in your drinking water, something you've been told is safe for decades, might actually be harming you or your kids? Or what if it's one of the greatest public health victories of all time? Today, we're diving into the heated debate over water fluoridation. Is it a miracle for your teeth or a hidden danger to your health? By the end of this video, you'll know what the last 5 years of cutting-edge research says, and it might surprise you. Stick with me, because this is about your health, your family, and the water you drink every single day. Now, before we jump in, let me ask you this. Have you ever wondered why fluoride is even in our water? It's not there naturally in most places, so why add it? And is it really doing what they say it does? Let's unpack this together, step by step, with science as our guide. Picture this. You're filling a glass of water for your child, trusting it's safe, clean, and healthy. For decades, we've been told that adding fluoride to our water is like a shield for our teeth, protecting us from cavities and saving billions in dental bills. The Centers for Disease Control and Prevention calls it one of the top 10 public health achievements of the 20th century. Sounds amazing, right? But then you hear whispers, claims that fluoride might mess with your brain, your kid's IQ, or even cause other health problems. Suddenly, that glass of water doesn't feel so safe anymore. As a parent, a caregiver, or just someone who cares about their health, you deserve to know the truth. Not opinions, not conspiracies, but cold, hard facts from the latest research. Let's start with why fluoride is in our water in the first place. Back in the 1940s, scientists noticed that people in areas with naturally high fluoride in their water had fewer cavities. This led to a bold idea. What if we add just a tiny bit of fluoride to public water supplies to prevent tooth decay for everyone? And so, in 1945, Grand Rapids, Michigan, became the first city to fluoridate its water. The results were stunning. Cavities in kids dropped by up to 60%. Fast forward to today, about 75% of Americans drink fluoridated water, and it's praised for reducing tooth decay by at least 25%, especially in kids and low-income communities who might not have access to dental care. But here's where things get interesting. While fluoride's benefits for teeth are well documented, the last 5 years of research have raised some big questions about its safety, especially when it comes to our brains. Let's dig into the science, starting with the good news. A 2024 study in community dentistry and oral epidemiology called the LOTUS study looked at adults and teens in England over a 10-year period. It found that people in areas with fluoridated water had 3% fewer invasive dental treatments, like fillings and extractions, and 2% fewer decayed, missing, or filled teeth. That might sound small, but when you consider entire communities, that's thousands of dental visits avoided. Another study from the CDC in 2024 showed that 1 year of exposure to fluoridated water in Colorado saved an average of $60 per person in dental costs. That's real money, especially for families struggling to pay for healthcare. Fluoride works by strengthening tooth enamel, making it harder for bacteria to cause cavities. The American Dental Association, the CDC, and the World Health Organization all back fluoridation at the recommended level of 0.7 milligrams per liter, saying it's safe and effective. Over 100 health organizations worldwide agree. And the most common side effect? Mild dental fluorosis, slight white spots on teeth that don't affect function or looks in most cases. Sounds like a win, right? Well, not so fast. The case against fluoridation, new concerns. Here's where the plot thickens. In the last 5 years, studies have started to challenge the idea that fluoridation is 100% safe, especially for pregnant women and young kids. The most alarming claims come from research linking fluoride to lower IQ scores in children. A 2024 report from the National Toxicology Program, part of the National Institutes of Health, dropped a bombshell. After reviewing dozens of studies from countries like Canada, China, and Mexico, they concluded with moderate confidence that drinking water with fluoride levels above 1.5 milligrams per liter is associated with lower IQs in kids. Now, hold on. The U.S. standard is 0.7 milligrams per liter, much lower than that. But here's the kicker. Some studies suggest even levels below 1.5 milligrams might pose risks. For example, A 2019 study in JAMA Pediatrics looked at 512 mother-child pairs in Canada. It found that higher fluoride levels in pregnant women's urine, around 0.4 milligrams per liter, were linked to slightly lower IQ scores in their sons by age 3 or 4. The drop was small, about 3 to 5 points, but when you're talking about a child's brain development, any drop feels significant. Another 2023 meta-analysis in public health confirmed these findings, suggesting fluoride might act as a developmental neurotoxin at higher doses. But before you panic, let's put this in context. Many of these studies were done in areas with naturally high fluoride levels, like parts of China or India, where water can have 2 to 10 times more fluoride than U.S. tap water. Plus, the studies often don't account for other factors, like diet, pollution, or genetics. A 2023 Australian study of over 2,500 kids found no link between fluoride at 1.1 milligrams per liter and cognitive or behavioral issues in the first 5 years of life. So, the evidence isn't black and white. What about other risks? Beyond IQ, some worry about fluoride causing cancer or thyroid problems. A 2021 review from New Zealand's Office of the Prime Minister's Chief Science Advisor found no reliable evidence linking fluoridation at current levels to thyroid issues or cancer. Studies on cancer, like one from the American Cancer Society in 2022, show no consistent link between fluoridated water and cancers like osteosarcoma, despite earlier concerns. The data on these risks is either weak or based on much higher fluoride levels than what's in U.S. water. Why the debate keeps going. So why is this still so controversial? Part of it is trust, or lack of it. When people hear about studies suggesting fluoride might harm kids' brains, it's hard not to feel uneasy, even if the evidence is shaky. Add to that the fact that fluoridation feels like a one-size-fits-all approach. You can't opt out unless you buy filtered water, and that doesn't sit right with everyone. On the flip side, public health experts argue that fluoridation is like vaccines, a community-wide benefit that's cheap and effective, especially for those who can't afford dental care. Here's a fascinating tidbit. The benefits of fluoridation might be less dramatic today than they were 50 years ago. Why? Because we're surrounded by fluoride now, in toothpaste, mouthwash, even some foods. A 2024 review in the Journalist's Resource pointed out that cavities have dropped in countries with and without fluoridation, thanks to these other sources. So, some researchers are asking, do we still need fluoride in our water, or is it time to rethink this practice? What's the bottom line? After diving into the last 5 years of research, here's what we know. Fluoridation at 0.7 milligrams per liter is still effective at reducing cavities, saving money, and improving oral health, especially for kids and underserved communities. The risks, like mild dental fluorosis, are minimal for most people. But there's growing evidence, still inconclusive, that higher fluoride levels, especially during pregnancy or early childhood, might affect brain development. At U.S. levels, the risk seems low, but we need more studies to be sure. Closing. Call to action. So, where does this leave you? If you're worried about fluoride, you can use a water filter that removes it or talk to your doctor about your family's needs. If you think fluoridation is a public health win, you might want to support it in your community. Either way, the science is evolving, and staying informed is your best defense. What do you think? Should fluoride stay in our water, or is it time for a change? Drop your thoughts in the comments below, and let's keep this conversation going. If you found this video helpful, please give it a thumbs up, share it with someone who needs to hear this, and hit that subscribe button for more deep dives into the science that affects your life. Thanks for watching, and I'll see you in the next one.